find that artery, I'm going to put my right here in the crook of his elbow, feel the pulse. I'm going to place the cuff there, making sure that it doesn't come around the edge of his clothing. And then I'm going to hold it and slide my hand around and make sure, it's not always real easy, make sure that we wrap it around. This is real life, live, so therefore it may take a couple of tries. But you can see how important it is to get it right. You really just don't want to slap on a cuff, all right? And ideally, you'd want it to be as straight as possible. Okay, why? Because it's going to give you the best blood reading possible, right? Blood pressure reading. Okay, then I would take this. This is a manometer. It just gives me millimeters of mercury of pressure. And I'm going to pump it up, okay, to a certain level. And usually, if I thought Ronnie was, you know, just may have a usual blood pressure, I may take it up to 200. And then I would take my stethoscope, and I would put my stethoscope right here on that artery, okay? And the other way you do is you put your stethoscope there and pump, as you pump it up, you listen for the absence of a sound, for the absence of the heartbeat. Now, once you get to that point, you go a little above, and then gradually release the pressure. Go very slowly so you don't miss when you hear the heartbeat start again, and then listen until you no longer hear the heartbeat. That top number is your systolic blood pressure. That means that you have overcome the pressure in that artery by the pressure of the blood pressure cuff. When it stops, it means there is no longer any pressure on the artery, and that's your blood pressure. Does that make sense to you? Now, many times, have you all seen people take it over sweaters and over shirts, and, you know, I would not recommend that generally if you want an accurate blood pressure, because that gives you another layer that you have to put pressure on before you put pressure on the vessel. Okay? Thank you so much. Are there any questions about obtaining an accurate blood pressure? Okay. All right. So you always want to make sure that you have gotten the right size cuff, you have placed it correctly, and the individual, including yourself, if you're taking your own blood pressure, is seated appropriately. The Joint National Committee on Prevention, Detection, Evaluation, and Treatment of High Blood Pressure came to a number of conclusions. They found that if you were over 50, the systolic blood pressure was much more important in deciding whether you were going to have cardiovascular disease risk factors than the diastolic blood pressure. They also found that the risk of cardiovascular disease starting at 115 over 75. Now, would you all think 115 over 75 was a pretty good blood pressure to have? Me too. Me too. But if you start there, you will double with each 20 millimeters of systolic blood pressure or 10 millimeters of diastolic blood pressure each year as you progress over the age of 55. So, at 55, if you have low blood pressure, you have a 90% lifetime risk. It's very common, isn't it? It's very common. Now, we also have a thing that we call prehypertension, and that's important to understand as well. And that's a systolic blood pressure of 120 to 139 or a diastolic blood pressure of 80 to 85. So even at 120 over 80, some individuals may have prehypertension. What are the consequences of hypertension? Primarily, we think of the cardiovascular disease, the CVD risks. That includes heart attack, heart failure, and stroke. What else can happen? It can affect the kidneys and cause chronic kidney disease. It can affect the other artery body, causing peripheral arterial disease, many people experiencing that primarily in the lower extremities. And it can also cause retinopathy, which means that the back of the eye that receives the information of light that comes through can get diseased as well and cause difficulties, including blindness. So, what does this tell us about hypertension? It can kill you. Very good. What else? I'm sorry? Yes, it can disable you. If it doesn't kill you right away, it can disable you, which may be worse, because then you are subject to much therapy, to the possibility of lots of medications, to large bills, medical bills, out of work time. Many happen because of that. And what does it show us? It certainly can affect our quality of life, can't it? And look, it's not just the heart, is it? It's not just the blood vessels.